Okay, welcome back. So this is chapter 42, and it is infection control. So buckle up. This is a lot of information. Okay. So what is an infection? An infection is an invasion and proliferation meaning reproduction of organisms in body tissues that causes illness or injury to the host, right? Something that makes you sick. And the goal of all healthcare is to break the chain of infection. And sometimes we need more than just universal or standard precautions to achieve the goal. And there's some special precautions, and we're going to talk about all of them today. So, the best method of infection control is prevention, right? That really makes the most sense. All facilities have to have some type of infection control plan and an infection control nurse or team. What they do is they make sure that any healthcare associated infections are getting reported. They work with employee health programs, isolation policies, infection control in services, and all that good stuff. So the CDC is always updating guidelines for isolation precautions. And right now we have two tiers. We have standard precautions. That is with the premise that everybody's got something. So all clients we use standard or universal precautions with, okay, regardless of what their diagnosis is. And then there are transmission based precautions. These are the ones that are designed for people with specific types of infections. Okay. So make sure you know the difference between standard and transmission based precautions. So the infection control team or the infection control committee, what do they do? We have to have them for accreditation. They monitor any infections in the facilities. If they realize that somebody made a boo-boo, like a break-in technique, then they try to figure out alternate procedures, develop new protocols, et cetera. And they report to governmental agencies, right? They report to Department of Health and Human Services, et cetera. Okay. So make sure you know there are some diseases that have to be reported to the local Board of Health because of the possibility they could spread like a pandemic or an epidemic. This is a list. It's not an exhaustive list. The full list is on the CDC's website. But this is a few: measles, mumps, rubella, which is German measles, tuberculosis, syphilis, Lyme disease, chlamydia, COVID-19, SARS, pertussis, whooping cough, HIV, anthrax, E. coli, diphtheria, tetanus. And like I said, there are more, but make sure you understand that those are a few. So you should at least be able to name a few of them, the big ones. Okay. All right. Pathogens. So pathogens are microorganisms, right? Microbes, we can call them too, that cause infection, but there are lots of different kinds of pathogens. So let's talk about them. So we have bacteria. Some examples: Staphylococcus aureus, E. coli, Mycobacterium tuberculosis. Then we have viruses, and they're organisms that use the host genetic machinery to reproduce. So, in other words, they will get into the body and they use your RNA to reproduce. Most viruses are self-limiting. In other words, they'll run their course and kind of burn themselves out at some point, but not all of them. And sometimes before they burn themselves out, they can do a lot of damage. Then we have the fungi. There's a fungus among us, and that includes molds and yeasts like Candida albicans, which is candidiasis, and aspergillus. Then we have prions. They are protein particles. Like there's a new variant for Creutzfeldt-Jakob disease. Don't worry about knowing that one. Actually, I'm going to unhighlight that because we will get into that when we get into adult med surg. And then there are parasites. Parasites are living creatures that live off of someone else's body. And parasites includes protozoa. Protozoa cause malaria and toxoplasmosis. And then there's helminths, which are worms, flatworms, and roundworms, and flukes, cystocomal. So, just know the basics of the parasites, but you should know the difference between bacteria, viruses, and fungi. Okay. So they're living things. All three of them are alive. All three of them can mutate, but they are a little bit different. Bacteria are not self-limiting. We need medicine to get rid of a bacterial infection. Viruses will burn themselves out. And a fungus among us, well, that's not going to go away unless we treat it medically. Okay. All right. So what is the chain of infection? So the chain of infection requires all of these things that I'm about to go over in order for you to become ill. So first, there's got to be a causative agent, a pathogen, bacteria, virus, whatever. And that causative agent has to be living somewhere in a reservoir, like it could be another human being, it could be an animal, food, organic matter on inanimate surfaces, water, soil, insects. Okay. Then there's got to be a portal of exit. So how does it get out of that reservoir? And then how do they, once it leaves, what are the portals of exit? Well, could be respiratory tract. In other words, one portal of exit is, for example, when someone coughs or sneezes, that's droplet or airborne, and that includes TB and pneumonia. Okay. Portal of exit could be your GI tract, right? Could be through your feces, right? Port of exit could be your genitourinary tract, like a urinary tract infection. Could be your skin, mucous membranes, like herpes simplex virus or varicella. Could be blood and body fluids, like Hep B and C or HIV. Could be transplacental. In other words, it can cross the placenta when mom is pregnant with a baby. And then it can also be contact. Contact is where you have to actually either have direct physical contact, person to person, touch, or indirect contact with an inanimate object, object to person. In other words, the lady in room 312 has C. diff. She wipes herself, but doesn't really wash her hands. So she's got it on her hands. She touches the doorknob. She touches the wall. Boom, right? Inanimate objects. And then there's fecal oral transmission. And that is just when someone handles food after they go to the bathroom and they don't wash their hands. Ew, ew, ew. Okay. Other ways of transmission are droplet. Droplet is sneezing, coughing, talking. Airborne, you can just be breathing and transmit a disease. And then there are vectors and vehicles. A vector is an animal or an insect that acts as kind of the carrier of the disease. So examples like ticks, they transmit Lyme. Mosquitoes transmit West Nile virus and malaria. So remember, vectors are living things, okay, that carry the disease. Vehicles are inanimate objects that can harbor these pathogens, like a doorknob or a table. So know the difference between a vector and a vehicle. And then once that portal of exit happens and that pathogen leaves the reservoir through one of those portals, it's got to get into the new host. Okay. So the portal of entry could be the same as the portal of exit. So in other words, if Johnny has the flu and he's within 3 feet of me and he's coughing up a lung, he is the reservoir for the pathogen, which is the influenza virus, which has a portal of exit from his respiratory tract and a portal of entry to my respiratory tract. But then I have to be a susceptible host. So I have to be somebody who is like a little weakened so that I'm going to catch that disease. And a susceptible host could mean anything from someone having a compromised defense mechanism, like they're immunocompromised or they don't have good skin integrity. If that's the case, then that susceptible host is susceptible to all types of infections because the defense mechanisms are decreased. Okay. So let's talk about these different types of precautions. So standard precautions applies to all body fluids except sweat and tears. It also applies to non-intact skin and mucous membranes, right? We use standard precautions, also known as universal precautions, for everyone. If we believe that we will come in contact with any type of body fluid or open areas of the skin or mucous membranes, we're going to wear gloves. Okay. You can use an alcohol-based hand sanitizer after contact with a client, as long as your hands aren't visibly soiled or contaminated with blood or body fluids after you take your gloves off. Okay. So with standard precautions, it's just based on the assumption that, hey, everybody might have something. So we're just going to be super careful and we're going to wear gloves if we think that we're going to come in contact with any of those body fluids. And body fluids means feces, urine, vaginal secretions, semen, blood. Okay. Those are body fluids. So It really is better to use hand sanitizer unless your hands are dirty, because the alcohol-based product is really more effective in killing all types of microorganisms. But if your hands are visibly soiled, or if the patient that you were just in contact with has like C. diff, soap and water, and it doesn't have to be antimicrobial soap. It could just be a plain old dial soap. Just soap and water when your hands are soiled or contaminated with any kind of blood or body fluid, or just if you think that you may have touched something after you removed your gloves that may be problematic, right? Wash your hands. Again, if the patient has Clostridium difficile, use soap and water, not hand sanitizer. Okay. Whenever you take off your gloves, you always do hand hygiene. Okay. And you always do hand hygiene between each client. There's other types of PPE like masks, eye protection like goggles, face shields. You would use those when you think that whatever you're going to do with the client might cause a splashing or spraying of body fluids, right? If you're going to irrigate a wound, you're going to probably put a face shield on. You don't want that in your face. So clean gloves are worn, not sterile, just clean. Anytime you're touching something that could contaminate your hands. That includes all body secretions, excretions, blood, body fluids, non-intact skin. We already talked about that. And hand hygiene is required after you remove a gown. Okay. And you always use a nice moisture resistant bag for soiled items and tie the bag in a knot at the top. When you're changing linen, by the way, don't ever carry linen up against your body, dirty linen, if you're changing someone's bed. Okay. So with standard precautions, you're going to clean all your equipment. Sometimes some facilities only use one-time use equipment, like they'll have disposable blood pressure cuffs in each room. But, follow your facility's policy. Bag and handle contaminated laundry to prevent leaking. So, make sure you don't hold it against your body. Put it in a bag right away and seal the bag. Make sure that if you have safety needles, you're using them, okay? And dispose of the needles immediately after use. And always put them in a sharps container, right? Which is a puncture resistant red container. And with standard precautions, the client doesn't need a private room unless there's some kind of an issue where they can't maintain their own hygiene, right? And then with certain diseases, and we're going to talk about those, okay? So that was standard precautions. Now we have transmission-based precautions. It's a little bit different. So this is what we use when we're taking care of someone with a known or even suspected infectious disease that's a specific disease. Okay. And the three types of transmission-based precautions are airborne, droplet, and contact. So let's talk about all three of those. So airborne precautions, I want my MTV. Okay. Airborne precautions are used to protect against droplet and micro droplets like measles, varicella, tuberculosis, MTV. Okay. And what are the precautions for airborne? Well, you need an N95 or fitted particulate respirator mask, right? The patient needs to be in a private negative pressure airflow exchange room. And that negative pressure, and this is a test question, has to have 6 to 12 air exchanges per hour. Okay, make sure you know that. Negative pressure room, private room, they can't share a room. Okay, even if you have 2 patients with TB, 2 patients with varicella, 2 patients with measles, they need to have their own room. Okay, if there's a possibility of any splashing or spraying of body fluids, wear a full face mask, wear protection. And if the client has to leave the room, someone with an airborne infection has to leave the room, they need to put a mask on. Normally, we will keep them in their room until we start treating them. Okay, so to make it less likely for them to spread the illness. Okay, that's airborne. Now, droplet is kind of a step below that. So anything that's respiratory, that's not MTV, is usually droplet. Streptococcal pharyngitis, pneumonia, Haemophilus influenza B, scarlet fever, rubella, pertussis, the mumps, different types of pneumonia, sepsis, and pneumonic plague. These are droplet. So droplet precautions are different. You can have 2 patients in one room if they have the same disease, okay? You have to keep social distance 3 to 6 feet from the client. You must wear a mask. And any providers that go in there, nurses, doctors, any visitors can go in, but they have to wear a mask. And the client should wear a mask if they leave their room or they leave their house. Okay. So droplet transmission is different than airborne because these droplets are bigger. They're macro droplets and they get propelled through the air when the infected person sneezes or coughs or talks or laughs. Okay. So always wear a mask if you're going to be within 3 feet of that person. Then we have contact precautions. Contact precautions are basically when we talk about blood and body fluid, and it can be direct or indirect content or contact, and we're going to talk about that. So they protect the visitors and caregivers from clients that have certain infections like respiratory syncytial virus, Shigella, the norovirus, which is an enteric disease, wound infections, something that's just in the wound, herpes, the herpeses, impetigo, which is hand, foot, and mouth disease, scabies, it's a parasite, and certain MDROs, multi-drug resistant organisms. Okay, so what's contact precautions include private room, or they can share a room with someone who has the same infection. Gloves and gowns required. Anything above gloves and gowns, if you think that there's going to be some kind of splashing or spraying, then you use clinical judgment and wear additional protection. But the standard for contact, gloves and gowns. And any infectious material, so if you're doing a dressing change on an infected wound, that type of thing, you put it into a single non-porous bag. Red biohazard bag is the best, okay? And don't touch the outside of the bag with that icky material, okay? Contact transmission, by the way, is the most frequent mode of disease transmission in healthcare. And when we talk about direct contact or indirect contact, direct contact would be, I don't have gloves on and I touch your infected wound, direct contact. Or someone has unprotected sex with someone else, okay, that's direct. Indirect contact can be something like where there's a vehicle involved. So the patient with C. diff, for example, who goes to the bathroom, wipes, doesn't wash their hands, touches the doorknob, touches the wall, and someone comes behind them, touches that same doorknob. So they didn't directly contact the patient, but it was an indirect contact. Things like gastroenteritis and skin and wound infections, the hepatitis the herpes and we talked about that, and pediculosis, which is lice. Okay. Now, understand that varicella is part of MTV. That means it's airborne, but with varicella chickenpox, there's a stage of the disease process where there are pustules that ooze, they itch and they ooze, this rash that you have all over your body. When they're oozing, then varicella is not just airborne, it's contact also. So make sure that you know that. Okay, varicella is airborne and contact when the pustules are oozing. Okay. If you have to administer medications to somebody who's in isolation, always follow your standard precautions and you get your medications ready outside the room, but take them into the room. Take anything that you need, hopefully disposable things like a disposable tray. And once they go in the room, they don't come back out of the room. Okay. You would dispose of them in the room. Okay. You're going to always wear gloves when giving injections. You should do that anyway. You should always have a sharps container in the room and use it. You should always make sure that any material that's disposable, you dispose of it in the client's room. So you remove your PPE while you're in the client's room. Never leave an isolation room with your personal protective equipment on, and make sure that you double bag whatever is yucky, dressing changes, dressing change supplies, those types of things, and the patient's linen, etc., double bagged. Okay. When you're taking vital signs on somebody who's in isolation, wear your PPE. Try to use a wall clock, and if you can, use disposable equipment. Most facilities are using disposable equipment, right, to try to prevent the spread of infection. And double bagging, right? Trash, refuse, and linens are always double bagged before you leave the room, and you tie a nice big knot at the top and then remove it from the room, okay, so that it's contained. If someone dies while they're in isolation, then you're going to continue with those precautions to prevent the spread of infection until we get the body to the morgue. Okay. Some facilities have their own protocols. So, of course, you'd follow those if they did. Okay. Then there's another type of isolation that's called reverse isolation or neutropenic precautions. This is where we're protecting the client from us instead of vice versa. These are clients that are immunosuppressed. They have either decreased or no white blood cells, and they're not going to show the classic signs or symptoms of infection, but an infection could kill them. So what kinds of patients are these? Patients with severe burns, bone marrow or even organ transplants, somebody with AIDS or HIV, somebody who's got cancer and is undergoing treatment like chemo or radiation, and people that have been on corticosteroids like prednisone for a long time. With these patients, we have to protect them from becoming ill. So we try to avoid anything invasive, right? No suppositories or enemas. Don't put anything in their butt. And if we can avoid IVs and IMs, we do. All right. The least invasive, the better. And with these clients that are in reverse isolation or neutropenic precautions, no fresh fruit, no fresh vegetables, no plants, no live flowers, and no uncooked or undercooked food. So what does that mean? No sushi, because that's not cooked. They cannot have a salad because that would be, fruits and vegetables, plants. Um, Anything that's undercooked, for example, eggs sunny side up or a soft boiled egg. No, no, no. Hard boiled egg. Yes, yes, yes. Okay. And then there are some special infections. We call these multi-drug resistant organisms. Okay. So these are the superbugs, we call them. The most common one, most of you have probably heard of it, is MRSA, stands for methicillin resistant Staphylococcus aureus. And then the other one is VRE, which is vancomycin resistant enterococcus. These are bacterial infections that have mutated and have become resistant to the strongest antibiotics that we have. So they can be very dangerous. Okay. And we're going to talk more about them in a second. There are also some additional infections that can occur. Cowties, catheter associated UTIs that you get in the hospital, ventilator associated enterococcus, VAE, right? Or central line associated blood infections, CLAPSIs. Okay. I'm not going to get into these. I want you to know MRSA and VRE. Okay. Multi-drug resistant organisms. Okay. So now, what do we do to treat these patients that are infected? So we use some type of antimicrobial therapy or medication. What that does is it either kills the organism or it slows down its growth. Okay. So what do we have? We have antibiotics. Antibiotics only attack bacteria. Antivirals only attack viruses. Antifungals are for fungi. And then we have antiparasitics that attack helminths, worms, ew, and protozoa, ew, which are things like amoebas. Plasmodium is an amoeba that causes malarium that's transmitted through a mosquito. Ugh. Okay. So remember, antibiotics only for bacterial infection. Antivirals can't kill a virus, but they can slow the symptoms down, make you feel a little better. Antifungals will get rid of a fungus among us, and antiparasitics, will get rid of helminths and protozoas. Okay. And that's important for you to know. And that is everything you needed to know for chapter 42. And we are signing out until the next chapter. See you later, alligator.